I'm going to tell you a little bit of a story about a time in my life. I was 3 months into my rheumatoid arthritis diagnosis, and I'd finally been feeling the difference of the concoction of drugs I was now on. As a pharmacist, I'd once empathetically laughed with patients when they made the inevitable joke about rattling when they picked up their monthly medications. And now I could make the same joke, 7 tablets in the morning and 5 tablets at night. Before my diagnosis, I was confident in all decisions I made, personally, professionally, and for my health. But that would soon change. My rheumatologist had said in no uncertain terms to get going on the offspring if I wanted to have any in my lifetime. She prefaced this by saying at 31, I still had some time, but RA may not help the cause. We had a plan and I felt supported. So I was pregnant. We were so excited, a baby, the first grandchild in our families. I remember my mother-in-law's eyes wide when we told her, full of excitement, love, and pure joy. And then, like a dark cloud rolling in before the storm, came the realization of we were having a baby, but I have RA. Will I be able to hold my baby when she's born? What if I can't pick her up when she's crying? All of the excitement was shrouded by this unknown. I wondered if I'd be able to do up the little pop clips on baby clothes with my fingers. A trip to a baby store to practice a few months later told me I wouldn't be able to. And so began a whole new level of RA management. Rolling bassinets, supportive pillows I could lay the baby on when I was feeding her, organising my husband to have 8 weeks of leave instead of the usual 2. I can't recall exactly how many times I Googled practical tips to prepare for a baby if you have rheumatoid arthritis. I was told remission might come when I was pregnant, but it didn't. A few months later, my rheumatologist reduced one of my medications, saying a lower dose was better in pregnancy. This wasn't in the plan. I remember bursting out into tears in her office at the next visit. I couldn't deal with the constant gnawing pain much longer. It felt like someone was injecting poisoned acid into my joints, and it was seeping all over my body. At the next visit, the rheumatologist made the decision to cease one of my medications I was on due to a risk of illness in the baby if she had breast milk when she was born. This was also not in the plan. I searched high and low for evidence that supported her opinion. I was very well versed on evidence-based decisions as a pharmacist. I asked my obstetrician, I tried to get in contact with a pediatrician, I asked pharmacist colleagues. I couldn't find any evidence, so I asked her for a paper that supported her decision, or even a case study of someone she'd treated. At 35 weeks pregnant, I was terrified I wouldn't be able to walk, let alone hold my newborn. She told me it was based on a theoretical risk and there wasn't any evidence to support her decision. After bluntly telling me her thoughts and that she had years of experience in the field, she added, "But it's your choice, of course." She didn't want to entertain any further discussion on it, and further attempts to ask questions were shut down. I felt paralyzed. I had never felt powerless when it came to a medication decision. I wondered if I'd lost my clinical skills as a pharmacist, if my degree and years of experience were worthless. If I couldn't help myself, how could I help patients? Other health professionals helped me through this time. A fantastic obstetrician that sought information from rheumatologist friends, a pediatrician who alleviated all my fears within hours of the birth, a caring GP who was as dismayed as I was, and a desperate phone call to a fellow member of Dragon Claw, who's a retired doctor, Charmaine, and her partner, a retired pharmacist. True evidence that this supportive community really does set out what it wants to do. My little girl Elsie arrived a few weeks early, but in October 2023, and she brought with her the greatest gift of remission from RA. I can do everything I wanted to do with her and more. We play on the ground, chase birds at the park, and I hold her up high to pick flowers from the trees. From this experience, I've really realized that patient empowerment comes from shared decision making. Shared decision making is vital and it leads to better quality health outcomes and decisions. When I was diagnosed with RA, I wish I'd known how much of an impact this disempowerment can have on your health. And I've shared this story today in the hopes that shared decision making and its impact can be front of mind for clinicians, for patients, and for their families. Thank you.